Obamacare is coming. Now, the deadline for the healthcare exchanges mandated in the law is coming really fast. It's supposed to start on October 1st of this year. Now, so far, 26 states have started creating their own healthcare exchanges. And let me get into that. The healthcare exchanges is basically where you go to shop for your health insurance. Now, 34 states will have federal exchanges run by the federal government. There was an article, and the exchanges is very important to what I'm going to get into. Now, an article in the New York Times has said that states that, such as New York, Oregon, Montana, California, and Louisiana, have reported that they will see a nearly 50% decrease in health insurance premiums. Oh, man, that's really nice. I mean, as a resident of New York, I know you've got to be excited about that news, right, Sean?
Yeah, sure.
So that good news. That's some really good news that we see from the New York Times. Really great story, but that is not stopping Republicans from continuing to target the law before it goes into effect. Now, one good example of this is Governor Mike Pence of Indiana. Now, he's been a staunch opponent of Obamacare, and just like many other Republican governors, he's been trying to target the law and destroy it before he can implement it. Now, an interesting story here about Pence's head of the Indiana Republican Insurance Department is a man named Logan Harrison. And he set out some press releases where he had said that premiums under the Affordable Care Act would be as much as 72% higher than what they are now. 72%. Holy shit. That's really high. Quote from Logan, he says, quote, "This new data regrettably confirms the negative impact of the Affordable Care Act on the insurance market in Indiana. The Affordable Care Act requires many Hoosiers to purchase more comprehensive and more expensive health insurance than they may want or need. These rates call into question just how affordable health insurance will really be for many Hoosiers." Now, hearing that, and then basically going back to the article in the New York Times, you're thinking, wait a minute. One place says that it's going to fall by 50%. Another says premiums are going to rise by 72%. Well, who's right? Well, it appears that Mr. Harrison had taken the average cost of premiums of all levels of the plans, bronze through platinum, bronze being the cheapest, platinum being the most expensive, and he averaged it out. And he took that average, which was about $570 per month per plan, and said, well, there you go. There's how much it's going to cost you. Now, for somebody making $17,000 a year, $570 a month is basically unaffordable. But now, that's actually not how much the premium is going to cost. That's actually, like I said, an average and an estimate of allowed costs, minus co-payments and deductibles. Oh, and would you look at that? He left out the government subsidy. That's amazing. Now, this kind of rhetoric is pretty similar to what we've heard also in Restate of Ohio. The Ohio Lieutenant Governor has said that the insurance premiums will go up by a shocking 88%. Damn. What do you think about that? You think it's going to go up by 88%?
No, there's nothing to worry about. The thing is, this is how they manage to manipulate the numbers. Like you said, they take averages, taking into account everything from bronze to premium insurance plans that only millionaires or people who are making hundreds of thousands of dollars a year would be buying and getting, and that skews the average, and that skews the numbers and the information. So that's deceiving people.
Right. Most people in Indiana and Ohio are basically, they're thinking that most of those people in Indiana and Ohio, they're going to buy the bronze plan, the cheaper plan, which is what I would do.
Right. And so, like you said, they always conveniently leave out the part about the government subsidies. I've actually read the bulk of the Obamacare um, plan. And there's a whole bunch of contingencies in there for both businesses, families, and individuals to make sure that they're eligible for subsidies, to make sure that everyone can actually afford the health care. A Medicaid expansion is also part of Obamacare. So most people in poverty would get Medicaid, even those that don't have it now, because that would be expanded to more people under a broader income bracket. And it would also extend the coverage to children and young adults. And even when you start making more money and you're out of poverty, then you still get government subsidies, and you would only end up paying about $25 to $50, depending on if you're single or have a kid or don't,
and of course,
what your age is.
I want to add in the fact that that's the Medicaid expansion is only if your governor has accepted it. Now, there's a lot of governors that have just said, hell no, I'm not going to take that. What do you mean? I'm going to take that money and I'm going to help poor people? Why the hell would I want to do that? And here's another thing. Here's another basically lie that a lot of these Republican governors like to throw out, is that they say, and this is a big one with them, is that it will provide insurance to undocumented immigrants. That is a lie. That is bald-faced, 100% untrue.
Yes, it's quite a deception, actually. Most people think that undocumented people are eligible for all kinds of welfare and health care benefits that they are not. When I had to sign up for welfare and government help programs and things like that, I actually had to go to great pains to prove that I was an American citizen, with birth certificates and copies of ID and Social Security cards, because you're not eligible if you're not a legal resident for most things.
Right, but of course you hear all that stuff on Fox News about how if you're an immigrant, you're getting all of this stuff that these hardworking Americans pay for. And
Right.
it's just it's a crock of bullshit. And so I just wanted to reiterate that, because that's, for some reason, a lot of the Fox viewers and conservatives are always worried about those undocumented immigrants. Oh my God, these illegals coming across the border, having anchor babies and getting welfare on my dime. And it's just not true. It's just not true. and here's something else too. Shifting away, going on to a kind of a different part about this, is that the main argument against Obamacare too is that it will cost jobs. It's a job killer. John Boehner's out there every day. Obamacare, it's costing jobs, killing jobs. Well, there was a study from the Center of Economic and Policy Research. Actually, it was a report that shows that a lot of companies, despite what they have been claiming, have not been cutting back on hours for its workers because of Obamacare. Now, if you can remember back during the election, Mr. John Schnatter of, what was it, Papa John's Pizza, the man that lives in a fucking castle.
With a drawbridge and a moat.
With a drawbridge and moat, is saying that Obamacare will ruin his business. Now, he's incredibly profitable, and it's been debunked about 500 billion times. The fact that it's not going to cost that much. On average, about 14 cents per pizza. 14 cents per pizza. But this is just one of those examples of these business people that are thinking that, or that are saying that we're going to have to cut hours. We're going to have to, cut jobs because of how expensive Obamacare is. Well, it turns out
they say the same. I'm sorry, but they say the same thing every time we propose raising the minimum wage too.
That too.
Oh.
And a part of this study actually said that 2/3 of the 1 million workers that work part-time actually did this by choice. So they actually work part-time by choice.
But the thing is,
Right.
if you set a threshold at any point, then some people are going to try inevitably to get under that threshold. So like if you're in a normal job and you're making a good amount of money, then the extra cost of insuring your employee isn't that much compared to their salary. But it's the people in the low end jobs that extra insurance is like it's maybe like an eighth, or it's maybe even a fifth of their salary just to cover their health insurance.
Well, that's
So
where
those
the
people
subsidies would
could
come
be,
into play. And
but
not
I'm
only
saying
that,
those people could be cut by their employers. Their hours could be cut down if
okay,
they're
well,
like low skilled workers.
look at who is who's been threatening to cut their employees' hours. You've got places like McDonald's, Walmart, Mr. John Schnatter of Papa John's, incredibly profitable businesses.
That's the thing, is that they're actually the healthcare law actually gives them an advantage, because like you said, it's only 14 cents per pizza to
Mhm.
insure all their employees under the new law. But if you're like a regular pizzeria, and you obviously don't have
Oh,
the economies of
but you're
scale.
missing.
But then,
But you're
then
missing the.
Obamacare gives small
I'm sorry, but
businesses
you guys.
subsidies to help cover their workers.
No, you're missing the fact that the government has given a lot of breaks and gives a lot of exceptions and help for small businesses so that they can do this. But that's one of the things that's not advertised very well. The Obama administration has done a horrible job in trying to sell this law to the people. I mean, I will never forgive Nancy Pelosi for coming out there and saying, "Oh, if you want to know what's in the law, just pass it and we'll find
Pass
out."
it first.
No, stupid move. Stupid move. The Democratic Party did not sell this law, and the GOP has jumped right on it. And so everybody is confused. Everybody's incredibly confused. And they're against the law. In fact, I want to bring up a CBS poll that said that 54% disapprove of Obamacare, 39% said they want Congress to repeal it, and 36% say they want Congress to keep or expand it. And you know why? It's because that nobody knows what's in the goddamn thing. They don't know that a lot of small businesses get a lot of tax breaks and help so they can afford to do the mandate. And another terrible thing is that the Obama administration has done is they've actually delayed the employer mandate and giving the GOP more ammunition to use. And I think that's just a stupid move.